Thanks for that. So yeah, at any point, if you have questions and on anything we're discussing, or if you have a question on something we haven't covered and you want us to consider, please use the question and answer function at the bottom of your screen rather than the chat. We will be pulling all the questions from the Q&A box at the end of the session, downloading those and then responding to them in writing and posting them to our COVID-19 page, as we did for the other webinars. So I'll briefly start. Things that we've changed based on feedback that we've gotten from these forums. When Mel and I did the original set a few weeks ago, one of those is our well child visits. If you attended the physician billing webinar, you'll note that initially we were not allowing for well child visits to be done by tele. In that webinar, we are allowing those, and we did put a global out for the parameters on that. It's just for those kids over the age of 2, but we will allow telehealth for well child visits. Also, if you attended our therapies webinar, our physical therapy, speech, and occupational therapy, we did not initially allow those evaluations to be done by telehealth, but we have extended telehealth to those PT and OT evaluations. Speech have always been able to be done by telehealth, so we didn't have to add those. They currently existed. We are allowing for those PT and OT evaluations as well as therapies to be done by telehealth. So since it is May 4th, we did a couple of weeks ago extend our telehealth coverage through the end of this month. So originally all those codes that were opened up that weren't previously covered telehealth codes, we opened up to the end of April. We did reassess that. And of course, since we're into the emergency period, those are all reimbursable through May 31st. Of course, we continue to analyze the situation. And if the emergency period persists, we will do the same and go into June. Again, be sure to keep up with our globals. That's okay. That's where we're really pushing out all of our most up-to-date information. Another thing that we've done was add our COVID testing lab codes. There are certain U codes that CMS has allowed for reimbursement for those testing and analyzation for the lab codes. Check our globals for more information on that as well. Let's see, question, please address the question of PTAs, can you do virtual visits? Physical therapy assistants. I'm not sure. We can answer this in writing. Our Jacqueline, that mostly would answer these, wasn't able to attend at noon today, but she will help us respond to all these questions in writing. We'll follow up on that one. Let's see. Can you provide additional guidance for providing care to a reasonable patient load while adhering to the CDC Oklahoma government policies in order to justify the Oklahoma Medicaid remuneration? Mel, do you know anything about that one?
I do not. I'm going to guess that it has something to do with meaningful use reimbursement. If that is correct, if you can just put that into your question, I'll make sure that I get the meaningful use team to answer that question. If it's in regard to something else, if you can just clarify a little bit more, we'll make sure we get it answered.
There's also a question around reimbursing for PPE. No, we, for Sooner Care reimbursable services, purchasing supplies for offices is not an option we've been given by our federal partners. Protocols for reopening. No, we, all providers should follow the governor's phased-in approach, as well as the local approach that's been implemented at your specific municipality. The Healthcare Authority is not giving any recommendations on when and how a provider should reopen, but continue to follow federal CMS guidance, CDC guidance, as well as state and local. So getting back to initiatives that we've requested since our last calls. Originally, as you remember, we submitted what was called an 1135 emergency waiver, where we got our initial flexibilities to be able to implement a lot of these policies. during the emergency period. Since that time, we have also submitted a disaster response state plan amendment, as well as an 1115 amendment to our current 1115 demonstration. Through the disaster relief state plan amendment, we submitted that about a week and a half ago to CMS, and we're requesting the following flexibilities, but I do want to caveat that we do not have approval on these yet. So when we get approval, we will be pushing out more up-to-date information as to how providers will implement these through our global process. One thing that we've asked to do in response to a request from our partners at the Oklahoma Psychological Association is we will allow independently contracted psychologists to provide crisis intervention services to the sooner care adult population. Currently, that provider type is limited to providing services just to kids in sooner care, but for the emergency period only, we'll allow them to be directly reimbursed specifically for crisis intervention for adults. We have also asking for interim payments to our rural independent Medicaid contracted hospitals. The amount of that payment would be 2 months payment based on an historical average reimbursement for those facilities. We are also asking for the same for our critical access hospitals, and they'd be eligible up to 125% of the historical average of their reimbursement as well. We are increasing our private duty nursing hours and rates for those PDNs that work with children who are on ventilators or have a tracheostomy. We're waiving calendar year 2019 potentially preventable readmission penalties. This is for our hospital providers, and this is during the emergency period. Let's see. For our nursing facility providers and our intermediate care facilities for individuals with intellectual disabilities, we are extending our therapeutic leave days. So for nursing facilities, we're taking those from 7 days up to taking that from 60 days a year to 70 days. We are also waiving the provision that payments for therapeutic leave days cannot exceed a maximum of 14 consecutive days in those facilities. We are also asking, and we've currently implemented this in our system, for those clients that are covered by our Intra-Oklahoma individual plan, we are suppressing the premium requirements during the emergency period. So individuals in that plan would not be required to pay their premium to participate in the individual plan that's administered by the Healthcare Authority during the emergency period. There have been questions around implementation in that particular piece. We will not later pursue those non-collected premiums after the emergency period. It's just that we will not require them during the time in order for someone to maintain their coverage. So that is all that we've requested in the further authorities. Now, I will mention that we received a lot of requests specifically around individual provider rate increases during the emergency period. Understand too that the state is getting certain allotments of money from the federal government in order to for the entire state to respond to the COVID crisis. Our CFO, Aaron Morris, has joined us online with us today, but his team has met with the state level leadership team several times. Secretary Maisie's over budget. All of the statewide requests have come in through that avenue and then prioritized as a state. So we were able to move forward with some of these things based on the federal dollar allotments that was decided to put forward towards the state priorities. But we will answer any additional questions if they've come in. Let me scroll down here. Okay, there's a specific code question we may have to answer afterwards. Has a reimbursement amount been assigned to CPT 87635? The Oklahoma Medicaid message dated April 27th stated CMS has not applied their rate, but they have now.
If that CPT code has a fee schedule, that we will certainly go out and see what that fee schedule reimbursement is and take it through finance. And once it is in our system, then we will do a global and let you know that you can bill that code and what the reimbursement will be.
So let's see, as we move forward, is there any look at using a hybrid method, like possibly seeing patients every other visit in person and the next one virtually. This would allow a larger time between in-person patient visits. So I'm assuming this question is with regard to after the emergency period has ended and how the healthcare authority will continue to reimburse telehealth. We are analyzing the data around telehealth usage. During the emergency period, we're kind of looking at that in comparison to increases in utilization and how that affects our budget. And we also want to see outcomes associated with these telehealth. That can be anything from actual health outcomes to customer satisfaction surveys on how they enjoy or how they feel about receiving their services through telehealth. So all that information will help guide us as we get out of the emergency period. We can't say for now, but just know that we are looking at it and we will evaluate that on an ongoing basis. Let's see. And sooner can the provider bill for teleconference visit if the things discussed are very similar to what would have been discussed in a face-to-face visit and the child is present? Sooner start. Mel, do you know anything on that one?
I
That would be a health department question, right?
Yes, we can verify with them. And we would
Check with
also,
our partner.
right.
So Sooner Start is a program administered by our partners at the health department. We can check with them and we can get that responded to in writing. Not familiar with our COVID page, it's okhca.org/COVID-19. We will put all the answers in writing on that page once this is concluded. What impact do you expect providers to receive with the state budget cuts due to budget shortfalls? When do you expect these to go into place, if any? We're still waiting on our budget. Our state leader, the legislature has convened today, and on their agendas is funding for not only the healthcare authority, but other state agencies. So we should know more the next upcoming weeks. And we'll start that process if we're required to. But right now, we don't have any exact figures that we could estimate any potential budget reductions, if any. So there's a question about accessing PPE. We can get you the link. We've been told, the governor designated a PPE czar for the state, and they've set up certain to get that. And I know that we have a link. I don't have it with me, but we'll put it in this the document when we're done here. So question around, do therapists fall under evaluation and management services? No. So I will say that for therapists, this could either be PT, ST, OT, or behavioral health therapists. They all have but each case, they all have their own codes and would not bill an E&M service. Are there any stipulations for telephone provider visits other than they don't have access to video telehealth equipment? Currently for telephone, we have only allowed, there are two, and actually this will cause me to clarify my previous statement about E&M. We have evaluation and management codes open for physicians to do telephonic visits. That's only for established patients. And then we have a couple of telephone codes for evaluation and management services for other licensed practitioners. And so those licensed practitioner E&M codes, which they're listed on our global page, you would provide these services by telephone, and we would allow it by telephone, but only for existing clients. So physicians would use the physician E&M, and then going back to my other response, a physical therapist or speech therapist or OT practitioner E&M code to do it by telephone. Now, if you're a behavioral health provider, our partners at the Department of Mental Health and Substance Abuse Services who administer the state's behavioral health sooner care program, they are allowing their behavioral health services to be provided by telephone using the GT modifier. Let's see, there's a question around budget cuts for dental. Again, we have not received a final budget yet, so we're not yet sure what we will need to do in order to address the state's revenue failure. If we are a medical clinic that performs COVID testing, both swab and antibody, what would the administration code be for doing the swab and the test? We will have to get that for you. I know that we are doing we do have a specimen collection code as well as the lab code. Again, look at our globals because we specifically gave our lab codes on the global page. Let's see. Is there a modifier for mental health video conference? So our modifier for anything related to telehealth is the GT modifier. Let's see, will Oklahoma Medicaid cover out-of-state visits? That's really going to depend on the type of service and whether or not the individual lives on the border or is visiting a border provider. But that would be our regular out-of-state reimbursement policy. That would not be something we've added because of COVID. Let's see, will new authorizations be issued in the coming months? Also, will authorizations that expired in April be extended? I would say that if you have not, again, that would depend on what type of provider is being asked or is asking the question. Direct you to our COVID-19 response page. And if you haven't had a chance yet to watch any of the webinars that Mel and I did a couple of weeks ago or review those questions and answers, we did answer a lot of questions around the specific provider types around prior authorizations, when they can be extended. I know that we're not a provider that needs to extend that prescription for the PA, but there is information we are looking for. And so visit your provider-specific webinar, and I think the answer will probably be there. When does telehealth reimbursement expire? Currently, that is set to expire May 31st, but we are continuing to evaluate whether or not the emergency period will be extended. If it is, we'll extend for another month at that time. All right, well, I'm waiting for other questions to come in and see. Mel or Aaron, do y'all have anything to update that maybe I missed or additional thoughts?
Aaron, yeah, go ahead.
I was in and out. I'm having some technology issues, but from what I heard, Trailer, I think you covered off on everything. There were a couple funding questions, and those are in queue right now. Trailer's right. We'll know more in the next couple weeks, and
Technical issues all around.
I never know if that was me or the other person.
Are you back, Aaron?
I am. I'm on and off, so I don't really have much to add. I'll leave it at that. So it was me again.
All right. Okay. Well, thanks for joining us, Aaron.
Yeah, and I don't have anything else except to reiterate that as we get new information from the feds, we will share it as soon as we verify that it's something that impacts our Medicaid program. And if you have any other flexibilities, please let us know. I do appreciate the feedback that we received from the American Academy of Pediatrics to help clarify our telehealth visits for our children. So please don't hesitate to reach out to either myself or Aaron or Trailer at any time, and we'll work through anything that you think is important to our population.
All right, we've got a couple more questions. So there was a clarification around the out-of-state. It's asking if we'll cover telehealth visits for out-of-state providers. So if we have a current contract with an out-of-state provider, yes, if they meet our current telemedicine licensure requirements. Now, we'll say that our provider enrollment does kind of look at these out-of-state provider contract requests on a case-by-case basis to assess whether or not we have a need for that particular provider type. So if you have a new provider that's wanting to enroll with Sooner Care during the emergency time, I would say to submit the contract, and it'll be evaluated. How long will meal providers be authorized to send out 2 meals per day? So that was something we did for our home and community-based waivers, and that will be through the emergency period. And the emergency period will go on so long until the president announces that it's no longer needed, and it'll go through the end of that month. Right now, we don't have a definite end date. See, this provider has several pediatric clients that the parents are very concerned about due to high risk. Is there a best place for them to communicate their concerns to the healthcare authority? Sure. Mel, do you, off the top of our hand, our member services email address?
No, I do not. You can certainly call the helpline and they will take your concern. I believe there's a way for our population to communicate us through our public website, but we will definitely get you some information with all of your members, and we'll make sure that all members know how to access us if they have questions.
We have a hospital billing questions. We're getting conflicting answers, sending paper claims, need confirmation. And I know we addressed, yes. So as I understand it, and Mel helped me here, that the initial claim should be submitted electronically, but it's adjustments of some sort for hospitals that can only be done by paper at this point.
Yeah, that's because of the attachment that's required. Can only, if it's a reconsideration and adjustment based off of your original electronic claim, yes, those do need to go by paper. What I will tell you is we worked out a process with DXC, our finance team, and our claims resolution team at the healthcare authority to get those claims turned around as quickly as possible.
There's a question about, are there any plans to suppress the 35-hour-a-week limit for behavioral health providers? At this point, there isn't, but I will remind providers that crisis intervention services are not included in that 35-hour-a-week cap. So if there's crisis services you need to provide in response to any feelings of anxiety that your clients are having, those will not apply to your cap. So here's a follow-up on billing. HCA 17 forms are not being accepted when we upload them into the portal. Will this be accepted electronically anytime soon, as all documents can be uploaded instead of being sent paper?
And the answer to that is yes. Right before we all had to leave the agency and go to a telework environment, we were actually working with DXC to make sure that there would not be a need for paper claims in the future. So that is on our list of things when we can get back to the agency.
And speaking of that, because I know I've gotten questions on the side as well, is currently, Mel, correct me if I'm wrong, but we don't have an estimated return to the office.
That's correct, yes. We are actually going through the process of making the agency socially distant compliant before we have people move back into the building. So our HR department is working with our chief of operations and our chief of staff and with OMES to make sure that when members or staff do move back, that they are in a safe working environment.
All right. Well, I have not seen any new questions come up in the last couple of minutes. Go ahead and wrap us up.
All right. Again, thank you very much for joining us today. It really is important to us to make sure that all providers and members know what's going on in the state, what's going on with COVID, what's going on with Medicaid. We will continue to have these as information becomes available. And Trailer and I may take this on the road at some point. We're getting very good at Zoom meetings. But anyway, please reach out if you have any questions. And again, thank you very much for attending today.